we've established the importance of a patient's inclusion in palliative care planning. Now, let's learn how to assess decision-making capacity. Capacity is mostly measured by cognitive function. Assessing decision-making capacity is important in patients with illnesses that affect cognition, such as dementia, schizophrenia, or delirium. Impaired capacity is common among adults hospitalized for medical illness. Studies show that up to 31% of hospitalized patients and 70% of those nearing the end of life may have impaired or diminished decision-making capacity. Let's use John as an example. John is an elderly patient that presented to the ER with a lower gastrointestinal bleeding. He was stabilized and admitted. The team caring for John suggested a colonoscopy. When this plan was shared with John, he was adamant, "No colonoscopy for me." In a situation like this, where patient preference contradicts medical advice, how can we determine if this is a legitimate and conscious decision?
First and most important, we must not assume a patient lacks capacity solely because their decision contradicts our advice.
Patients are diverse, and their values and priorities can be very different from our own. We suggest assessing capacity using a semi-structured interview. First, you will assess understanding and correct any misconceptions or factual errors. Then, you ask the patient to communicate their choice. Next, you will assess appreciation and reasoning behind that choice, and finally, reassess and confirm it. Now, we are going to detail each of these steps. Let's start with understanding. The ability to understand is crucial for decision-making ability. In our case, we can assess understanding with open-ended questions. Does the patient understand what a lower GI bleed is? Does he know what a colonoscopy is? If so, does he know why we think one is necessary? Then, focus on communication. John must be able to clearly communicate a choice when presented with more than one treatment option. Frequent reversals of choice or unclear answers such as "doesn't matter, I don't care," may indicate lack of ability to critically think. And next, appreciate. Knowing the facts is important, but applying these facts to one's own life is what makes a decision authentic. If John understands his diagnosis, how it affects him now, and might affect him in the future, he shows that he appreciates his diagnosis and prognosis. And lastly, reason. The patient can compare treatment options and consider the consequences of each choice. To understand John's choice, we may ask, how is not having this procedure better than having it? John tells us he already had a colonoscopy this year. He tells us two things. One, that he stayed in the hospital for a long time and suffered a lot while preparing for the procedure, which turned out to be non-diagnostic. And two, he really wanted to go to his grandson's first birthday, which is happening in 4 days. John successfully established capacity. He was discharged and will continue treatment as an outpatient. Suppose we had assessed and concluded that John lacks decision-making capacity. In this case, we could utilize John's family to learn more about his values and priorities.
A living will was not necessary for this event, but could help us understand more about John's preferences moving forward. Let's continue more on this in the next lesson.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.